Remember, I have to pan back to you guys after, too. Okay. Have you ever accidentally put diesel fuel into a regular gas vehicle? Most people would never do that because they know it would cause serious damage to the engine. The same idea applies for antibiotics. Antibiotics are designed to treat bacterial infections, not viruses. However, many people still believe antibiotics will help them recover from illnesses such as the flu, a common cold, or COVID-19. Because of this misunderstanding, antibiotics are often prescribed or requested when they are not needed. Over time, this unnecessary use has contributed to one of the biggest public health concerns in the world, called antibiotic resistance. Today, I will want to explain why antibiotic stewardship is a serious problem, what causes it, and what we can do to help protect the life-saving medications for future generations. First, let's talk about antibiotic stewardship. Antibiotic stewardship simply means using antibiotics the right way. Healthcare providers work to make sure antibiotics are only prescribed when they are truly necessary and that patients receive the correct medication, the correct dosage, and the correct length of treatment. The goal is not to stop people from getting antibiotics when they are needed. Instead, it is to make sure that antibiotics remain effective for years to come. When antibiotics are used correctly, they save lives. When they are overused or misused, antibiotics begin to adapt and become resistant to the medication. One of the biggest misconceptions is that antibiotics works against every illness. In reality, antibiotics only treat bacterial infections. They do not work against viruses, and such as flu, RSV, colds, and most sore throats. Viral infections usually improve with time, rest, fluids, and over-the-counter medications. Taking antibiotics for a virus will not make anybody recover faster. Instead, it exposes the body to unnecessary medications and increases the chance of bacteria to develop resistance. So what does that mean for antibiotic resistance? Antibiotic resistance happens when bacteria changes over time and learns how to survive the medication that were once able to kill them. The antibiotic itself does not become weaker. Instead, the bacteria becomes stronger. As resistant bacteria continues to spread, infections become harder to treat. Doctors may have to prescribe stronger antibiotics that can have more side effects, cost more money, or require patients to be hospitalized. In some cases, there may be few treatment options left. This means infections that were once considered simple and easy to cure could eventually become life-threatening. Antibiotic resistance affects much more than the person taking the medication. Resistant antibiotics can spread between family members, classmates, co-workers, and the entire community. They can also affect patients who have weakened immune system and that are receiving cancer treatments or recovering from surgery. Procedures that we often take for granted, such as organ transplants, chemotherapy, and even routine surgeries, depend on antibiotics to prevent and treat infections. If antibiotics stop working, these medical procedures become much more dangerous. Another reason for antibiotic resistance continues to grow because many patients expect an antibiotic every time they visit a healthcare provider. Some people feel disappointed if they leave an appointment without a prescription because they believe medication is always the solution. Healthcare providers often have to explain that antibiotics will not help viral infections and that supportive care is the safest treatment when it sometimes is difficult to hear that no antibiotic is needed. As someone who works in the healthcare, I've seen this firsthand. how often patients come into the urgent care and they often expect antibiotics for illnesses that are caused by viruses. Many patients simply just do not realize that there is a big difference between bacterial and viral infections. This is why education is so important when patients understand why antibiotics are not always the answer. They are more likely to trust their health care provider for recommendations and avoid taking medications that they do not need. There are several simple ways that everyone can help prevent antibiotic resistance. First, only take antibiotics when they are prescribed by a licensed healthcare provider. Never pressure a provider to prescribe you an antibiotic if they tell you it is not needed. Always finish your medication even if you are feeling better. And good hand washing, staying up to date on recommended vaccines, and preventing the spread of illness can also reduce the spread of antibiotics, or the need for antibiotics in the first place. Healthcare providers also play an important role. They can continue to follow antibiotic stewardship guidelines, carefully evaluate patients before prescribing antibiotics, and educate patients on bacterial versus viral infections. And they only prescribe antibiotics with clear, evident need for the medication. In conclusion, antibiotic resistance is a growing health threat, but it also is something that we all have the power to help prevent. Every antibiotic used correctly, we can help protect the effectiveness for ourselves, our family, and our future generations. The next time you have a cold or the flu or another viral illness, just remember that antibiotics are not always the answer. Think back to my first question. Would you put diesel in your regular gas vehicle? Of course not, because it would not be ideal for your car. The same thing applies for antibiotics. By understanding these differences and using antibiotics responsibly, we can also play a big part in slowing antibiotic resistance and protecting what is most important to us. Thank you.